Well, now what you most of you have been waiting for is our speaker. And to introduce our speaker today is David Bossman, past president of our Rotary Club.
Thanks, Gary. Can you all hear me?
Yeah.
Yep.
Good. Buenos dias. Welcome to our guests. And welcome to my dog. Gary, I want to congratulate you first on another great year. Thank you for your work as our president. Welcome to Skip Essick, who will take over very soon as our president. And I'm delighted to be here with all of you today. Today is very special because I've had the honor of introducing to you an individual who should need no introduction, but many of you do not know her. And to be honest, scarce 3 or 4 months ago, I did not know her personally. I'm talking about Chris McCaskill, who of course is now known to most of us as she and her husband Rex putting together Masks for You. And I'm glad to see so many of you turn out today to hear from Chris. A little bit of Chris's background. Chris earned a Bachelor of Social Work from Michigan State and also a Master's in Social Work, specializing in Social Welfare Administration from the University of Michigan. So she's a loyal person of 2 Michigan great universities. She has worked with high-risk clients in a county public health agency, served as a hospital director of social services, and for 30 years did policy analysis and development at the state and federal level. She had the privilege of also, and this is a big one, although it goes back a few years, working on a consulting position on a deputy level with Al Gore and Bill Clinton way back when, reinventing government initiatives. Just a little bit more about the organization, then I'm going to turn it over. Masks for You, which came into being because of this terrible coronavirus, is a grassroots movement based on the common premise among sewists that in time of need, sewists, that's sewers, step forward. They have about 25 volunteer members and a handful of paid costureras. And by the way, Chris and Rex have been taking the money for these sewers out of their own pocket for months. When funds allow, the group has the infrastructure to produce over 1,000 masks per week, which meets the WHO, the World Health Organization guidelines. They have already donated over 7,000 masks since its inception in March. Listen to these groups now. To ABBA, the house located in Celaya, I believe, ABBA House Migrant Sanctuary, Cruz Roja, Feed the Hungry, Amigos Al Cien, nursing homes, and many more. And of course, they've been working with the local government and helping them. Chris will tell you more. It's my great pleasure to introduce Chris McCaskill.
Okay. Thank you. Am I unmuted? It looks like I am.
Yes, you are.
Yes, you are.
Okay, very good. I'm so grateful to have a chance to honor the women and a couple men that we've been working with together on Masks for You. Everybody that has been a part of this project are working in isolation. They're working under decentralized conditions, and yet it's a pretty close-knit group, and everybody has responded so much to drastic changes. We're past 90 days now doing this project, and there have been many changes. And I'm just really grateful to be able to honor the people who have been a part of this by being able to talk about it today. You're going to see a photo presentation in a few minutes. It's a 5-minute presentation, and it shows some photos of the only time that we have gotten together as a group. It's the only time that many of the people were able to meet one another. And there's a song in the background that we've adopted as our theme song. And I think you'll see the emotion in the faces of some of our members who have given an awful lot to this. The only thing I'll say is we're not paying a lot out of our own pocket. We have had the benefit of donations, but those donations, they come and go. It's kind of week by week, and but we're doing whatever we can to kind of keep things going. We don't want to have any downtime if we can avoid it. So I don't want to take credit for being a huge donor for this project. Too many other people have been a huge part of it. So if Ron will show us the 5-minute video, we'll talk after that. Wow. That I always get a little emotional when I watch that, and thank you. I see that some people are applauding, and I appreciate it very much. Last week we heard here at the Rotary Club, we heard from a futurist and a global thinker, and this week we're really in the weeds here with this mask making. But I have to say that with an activity like this, you have to start with a broad view. You have to think about science and psychosocial aspects, both within our own team and all around us. There are politics, there are economics, and there's strategies and tactics, and we've had it all. We always joke a lot about our tiny little operation, how we have a planning division and a research and development area and shipping and receiving and accounting. We haven't really been doing active fundraising, but when people come to our door and ask for a few masks, we never turn anybody down. And it's these very small donations that have come to us that have let us keep going. And we hope we can go as long as we're needed. And if the supply chain allows people to start getting their own face masks, their own personal protection equipment, or there's some other mechanism that works better, then a break will also be very welcome. We've only been at this a little more than 90 days, and it seems like almost daily things are changing. I remember back in January, there was a New York Times article, and they were talking about how people in China were using masks, but questioning whether they really did any good, quoting some scientists saying that, who knows, they may be more trouble than they're worth if they give us a false sense of security. So that doubt still continues. There are a lot of people who believe that masks are very unnecessary. We didn't know much about this whole mask business. I remember I needed to go to La Comer for something, and I was wondering what the requirements were, and somebody said, you only need to have gloves and a mask and you'll be fine. Well, they lied to me, because when I got there, everybody else was wearing clothes. And, but nobody's laughing. You didn't get my joke. No, I'm just joking. That's hard to tell a joke when you don't have any kind of sound reaction. That the photos were the only time we got together. Thank you, Lee Carter, and my husband Rex for talking with us about the video, and thank you, Ron, for getting us set up. I don't want to say a whole lot more other than to say that we are approaching 7,000 masks that we've done. We can make 1,000 to 2,000 masks a week if the resources are there. We pay local sewists. They love the work. That is one sideline about it. You can argue whether they help or how many they help or to what extent they help. We've always said it could save one life, and if it's somebody's grandmother or mother who is protected by the use of a mask, that is a very valuable thing. And I believe that it could happen, that it does happen. But to be able to employ people in these tough times is a very big deal. 500 pesos pays a seamstress to make 50 masks, and that adds up in a hurry if we have the donations. I talked about back in January and February when there was an awful lot of skepticism about masks and whether they did any good. And I was tracking some of the findings that were coming out of industrial hygiene organizations, the National Science National Academy of Medicine, the National Academy of Sciences. And in the beginning, there was a fair amount of doubt. On February 29th, the US Surgeon General Jerome Adams tweeted, "Seriously, people, stop wearing masks." That has changed a lot to about, what was it, about a week or 2 weeks ago, when the World Health Organization came out with very specific guidelines as to who should wear masks under what circumstances and what those masks should be comprised of. The guidelines now say that for a cloth mask, we should have 3 levels. We should have a hydrophobic level, which is usually a polyester, and in the middle, a polypropylene. The same ingredient, the same material that's used for the very highly effective N95 masks. And then on the inside, close to the face, a cotton fabric. And so we sourced the polypropylene. We started making those masks about, I guess it's been a couple weeks now, and we're fully productive. We're ready to go with those. And we provided about 50 to the Leon COVID hospital through Joey not too long ago. The beauty of that is they all want and need the N95 masks, but it's very hard to know how successful they'll be in sourcing those. They are disposable. They're not supposed to use them even one all day long. They're supposed to change them as they go from patient to patient. And it's difficult to maintain those. Joey is doing a fundraising, a GoFundMe account right now to be able to get funding to secure those masks for healthcare professionals. But in the meantime, we're here to fill the void. Excuse me, I'm so sorry. We're here to fill the void, and we'll do whatever we can to do that. I would like to maybe take some time for questions now, and I could go into great detail about the history of how people came to argue for and against the use of masks, or we could also talk more about our process and procedure, but let's see what kind of questions people have and go from there.
Chris, I have a comment.
Sure.
I was in the Hardin this week, and I was amazed. 95% plus were wearing masks.
Wow.
And this was predominantly Mexicanos. And that is a huge increase, and I have to credit you with getting masks to them, and they are wearing them. So I was stunned that it's gone from probably 50% to 95% in the last 2 months. So congratulations.
Thank you. That's pretty impressive. You know, a huge part about any public health movement is it starts out pretty shaky. You hope that some culture change takes place. You saw the little boy who happened to be, it was Michelle Garrison's son, and she was here at the house with her children. And the little boy was taking fabric. He saw us making masks, and he picked up a piece of fabric and put it over his face. And this is just a way of starting for people to be enculturated, I think, to the idea that masks are part of at least our current norm. And, it can be something that, that they want to emulate, that they appreciate.
Okay, if I may, we have a question from Nori.
Actually, I have a comment. Good morning, everybody. Well, I wanted to speak exactly of that, Chris. I don't think a lot of people realize, what really happens before the idea. So I want to really, really congratulate you and your team. The vision that you had of getting this whole project, even started when people really didn't even know what was going on, let alone finding a solution. I think that, you know, a lot of people that are not going out there into the communities might not really be aware of the huge impact that your group has actually accomplished. When I go out on a weekend to distribute food with Amigos al Cien and, you know, with Corazones Unidos, and we see hundreds of people lined up, and we do our very best, you know, to do all the social distancing and all of that, but to be able to hand them a mask that they can wash and they can reuse, and that they can know that they're going to be safer by that. It's a huge thing, Chris. It really is. And if it wasn't for masks for you, I don't know what would have happened to this community, really.
Oh, Nori, that's a very wonderful thing. And I'm sure that really makes the people who are doing all this work feel so good about it. It must be hard for everybody who sits at their sewing machine or sits at the cutting board, cutting fabric. We have a WhatsApp group where we try to share pictures and try to share thoughts and ideas, so it won't be such an isolating activity. But I don't think that the folks who do all this work do understand, do hear the kind of appreciation that's generated by this. So thank
Well,
you.
we are preparing something in the way of thank yous to a lot of people that make the actual work that is being done as a group by Corazones. We're preparing some thank yous because without all those little components, you know, the whole thing would not be as successful. But the masks are huge, huge part. And, you know, I know you have some people in your group that are personally known to me, so I do get to tell them on occasion, but please relay the message, and soon they'll have something more formal so that they can know how appreciated they are, especially las costureras, the ladies that are there sewing. My mother has been a seamstress all of her life, and so for me, I know how important that is for them to hear the thank you.
Oh, thanks.
Thanks,
so
Nori.
much.
We have a comment from, it says Fred, but I bet it's Barb. Yeah, she's waving. She says, "Hi, Chris. Good to see you, girlfriend. Could you please explain the easiest way for the folks in this meeting to donate?"
Thanks. Thanks, Barb. I'm glad you asked that question. And we were very reluctant when we started doing this work to ask for money to have any kind of formal fundraising activity. We started out, a lot of my quilting and sewing friends, we reached into our own stash and started pulling out materials. And then we ran out of fabrics to donate. And thank you to Lee and to Patrice and to Phyllis Gordon, and many others gave us fabric to use. And then when the WHO changed the guidelines and recommended putting polypropylene and putting polyester on the outside and polypropylene on the middle, we needed to source that. And none of us quilters, sewers have polyester, so we had to go out on a search for that, and people came to our rescue. As far as donating, Barb, all that to say, we don't have a GoFundMe account. Rex and I have a PayPal account, and that's his email. That's Rex McCaskill @gmail.com. And we have received some PayPal donations. Most of the money we've gotten has been when somebody comes to our door and wants 4 or 5 masks to give to their employees, or, you know, to people in their circle. They hand us pesos in efectivos, and that may be a little bit kind of a decentralized, kind of small potatoes kind of way, but we've been able to keep going on that. So we may have to break down and do a GoFundMe or try to figure something else out. I know Jessica Frick is looking at a way to create an order form online on their COVID-19 task force that would enable people to purchase either the not the N95s, but the medical surgical masks that they are likely going to be able to source. People can buy those disposable masks, probably in a lot of 5, but they can buy or they can buy masks for you mask for at cost, and they can opt to buy one and donate one. And I think there will be a mechanism where they can also donate larger quantities through that mechanism. So we'll see if that gets rolled out in the next week or so. That might be a very helpful way to go about things as well.
Okay, we had a hand up from Dilshan.
Hi. Hi,
Hi,
amigo.
Chris. It's a great job that you're doing.
Oh,
Can you
thank
hear
you.
me? Yeah. My question is, the thing is this mask is accepted by the Protección Civil? Because next 15th of July, I have the inspection to get my certificate to reopen the restaurant, even though I never closed. Under the table I've been working because I cannot afford to close. So what I want to know is all my staff are using your masks, and what I want to know is the Protección Civil will accept this, because I heard that they are not accepting it. We have to buy like that 120 peso N95 mask. And is there a way we can work with the Protección Civil and reach them and tell them this has all the things, it's locally made, and can we get it and save that money, because 120 pesos, it's a lot these days.
I thank you for asking that question. I believe that they are happy to see anybody coming in with a mask of any sort. They're not evaluating the type of mask. We've been in contact, thanks to Danny Briones, we've been in contact with Protección Civil at the checkpoints. And we know also that they're purchasing their own masks, the black or blue to match their uniform. That's quite an effort on their parts too, to keep themselves in masks. But we're looking at ways that we could perhaps give them supplies that they could use if somebody does try to go through those checkpoints without masks. And I believe that these cloth masks that are approved by the World Health Organization now, and the ones that we have given out before that are made with usually 2 layers of cotton and a sleeve to put a filter in, I would be very surprised if anyone found fault with any of those masks, and I have not heard that they would. I think you should feel very secure with that. But we're going to stay in touch with them and see if there's a role we can play. Because what has always bothered us, somebody is working hard to get on the bus and travel to whatever job they have, or to get to a market to buy food, and they don't have a mask on, and that now is in violation to ride public transportation without wearing a mask. We want to be sure that it's not all punitive, it's not all corrective, but that there's some sort of an opportunity to give them a mask. And we did that on a kind of a pilot project with a couple buses. We found some bus drivers who had regular ridership, people who came from the Campo and rode the same route every day. So he gave out masks to each one that didn't have one. And then he tried to monitor, not any pressure, we are not enforcement, but trying to make note. Do you see them wearing that mask the next day and the next day? And I think this is a change management kind of a, thing. It's going to take some time, because they like the mask when they first get it, but complying, wearing it whenever they should is not always easy adaptation. And I'm guilty myself. I go to my front door and I trying to, every time I hear the doorbell, I'm trying to remember, let that be a cue, put your mask on. But people who I greet at the door will tell you many times I've gone to the door without that mask. So I'm trying to change myself as well.
Okay, David Bossman has his hand up. David,
Hi, David.
unmute.
Where are you, David?
He's got to unmute.
Can you hear me?
Yes.
Now.
Following up on your last comment, I've been particularly concerned about the public transportation. I think that even though the municipal government has done basically a good job, I think one of the big weak spots has been the buses and the crowding of the buses. And you and I discussed this a little bit last week. I'm really concerned. I know you're working with the transportation director, and you've mentioned that, but I'm really concerned about the distribution, because what we're finding is that many people, especially going into the campo, will take the mask, okay, that is distributed, sit next to each other, okay, on the buses, and then when they're getting off, they already have the mask in hand. I don't know what could be done about that at this particular stage. I do know this, that at the beginning of the pandemic, Oaxaca, which is one of the poorest states in Mexico, they set up their transportation system where every other seat on the bus was taped. And I've never been able to figure out why we haven't done that in San Miguel. Very rarely, even except maybe during what we would call rush hour, are all seats needed. I think by people sitting next to each other on the buses without masks, it defeats a lot of the purposes and it accelerates the spread of the contagion. What do you think?
I think that's a very valid concern. And like I've said many times, it's so hard because enforcement or even promoting cultural compliance is kind of falls outside of our purview. But I think that we can work with officials to encourage those kind of practices and hope that they get adopted. I think you're right. People have them, or they wear them around their neck, or they wear them under their nose. We saw that in some of our photo presentation. It's compliance and full compliance is unfortunately doesn't happen as quickly as we would like it to, but we can always promote that. I think what we have to be careful of as gringos, and I have seen it, walking down the street, you see somebody without a mask, and I've seen people with that pointed hand come out and, just literally telling them how bad they are not to be wearing their masks. And I don't think that works. I don't think that kind of scolding is all that effective. I've also had people offer, just kindly go up to somebody without a mask and say, hey, do you need a mask? Here's a mask if you need it. And that's not always well received either. So, it's very sensitive, and there are also politics involved. People who believe that by wearing a mask, they're somehow supporting one political perspective versus another. But the question's good, and I hope that that we'll see more sophistication in the way these enforcement efforts take place.
My belief is that in this community, compliance is self-directed. We don't need to point people at. I've already seen it increase, as I talked about before, is the compliance has gone up dramatically, and not through anything we've done, but the availability of masks and the realization that, yeah, I probably should wear a mask.
Mm-hmm.
And I think that's been remarkable. I think, Ron, you had a comment you wanted to make?
No, I just have an announcement when everyone's finished.
And Norman has something.
Carlos G is asking if you kindly repeat the quote price if we want to buy masks from you.
We will never quote you a price. If you want a mask, we will give you a mask. And if you want to give us a donation, I don't care if it's 30 pesos or 50 or 500, we're going to accept it gladly. But we will never give you a price for a mask.
Okay. Norman.
So, Chris, I want to compliment you on this project and the work you're doing. And for us as Rotarians, it's a particularly meaningful demonstration of the fact that a motivated person with a great idea can make a difference. And you've recruited other like-minded people to work with you, but single-handedly, you started something that has helped so many people, and it's a lesson to all of us as Rotarians. So thank you, and my compliment.
Thank you, Norman. And this, again, this initiative was generated not by me, but by a group of people. And I also wanted to say, when we were talking about transportation, I wanted to say that Yoli Del Rio on our team is working with Alejandro Saavedra on methods that can be used to make sure our masks are distributed. I understand there are over 500 units of transportation. I don't really know if that's buses plus cabs or whatever that might include, but they're all now subject to regulation. They are required that people on those vehicles have masks. So I hope that having that requirement will have some follow-up with the things that David suggested to help more compliance, because distancing is every bit as important as masks. In fact, that's the first checkpoint, that you distance. And in case you don't always keep that distance, the mask is a fallback.
Well, we have solved the bus problem with our housekeeper. We do not allow her to come or go from our house on a bus. We give her cab fare both ways. And she wears a mask and gloves the whole time she's with us. And it has been very, very successful.
Okay.
So you don't have to worry about having your help riding the bus if you pay for cab fare. So Chris, thank you very much. This has been enlightening, encouraging, and I wish you all the best as you go forward.
Thank you very much.
You're very welcome. I would like to close the meeting with Bart to give us an update on how membership went this year.
I don't, Gary?
Yeah?
I know Susan O'Neill's been jumping in and trying to get a word in. Is that all right if we?
Yeah, Susan, go ahead.
I just wanted to inquire where Chris is located.
Okay. I live in El Paraiso, not far from where the Rotary used to meet. Our address is San Gamaliel, number 26. But if you'd like to email me at chrismsma@gmail.com, I can make arrangements to meet up with you and provide you masks if you need them.
Thank you very much.
Sure.
Skip, you had something to say.
Unmute, Skip.
Okay, Ron, you're on.
No, I'm here. I'm here.
Okay.
Yes, I do. Just very, very briefly. Thank you, Gary. Next week, I'm looking for a speaker. I know it's short notice. Nori, if there's any way, we'd really like to get Paco Garay back on to get an update on how things are going. And if not him, Ivar, maybe you might be able to help us get somebody to talk about the big roundabout project. That's all I have. If you can, and if anybody else has any ideas, email me, okay?
Okay.
I'll work on it.
Okay,
real,
Ron.
Real quickly, it'll be interesting next week. I'll report the city of Miami Beach, and some cities here have announced that effective, I think tomorrow, masks will be required everywhere, including out on the streets. I don't think for a minute that's going to work, but we'll see. My announcement is this. I want to extend my thanks to Ron Lennox of Discover SMA, who's been posting these meetings, the videos of these meetings on his YouTube channel each week after it's over. Because I get lots of emails from people wanting to see what they missed if they couldn't be here. He says he's going to try to do that again. But we have a little problem because that wonderful song by Mary Gaucher that was in the video will be pulled down by YouTube because of licensing. So we're going to try to do something about that and get this video out to people who want to see it later. So I know I'm going to get tons of emails. We are working on